In 1863, a soldier with a fractured skull was carried into a battlefield hospital. He had trained doctors, steel instruments, a real building with a roof. His odds of surviving that operation were roughly a coin flip. Now travel back 400 years earlier to the mountains of Peru. No hospital, no steel, no anesthesia, no germ theory. Just a person with a sharpened stone and a patient who was fully awake. And in that world, the patient's odds were dramatically better. Not slightly better, not by a rounding error. Better by a wide, uncomfortable margin. That's not a legend. It's measurable from the bones themselves. So how did that happen? And more importantly, how did anyone survive being cut open while fully conscious? The answer is stranger than most people expect. The procedure is called trepanation. A surgeon cuts or scrapes away a section of the skull without touching the brain underneath. It is the oldest known surgical practice in human history. Archaeologists have found more than 1,500 trepanned skulls on every inhabited continent: Europe, China, Russia, Scandinavia, and above all, Peru. The evidence stretches back at least 7,000 years. At some Neolithic sites in Europe, between 5 and 10% of all recovered skulls show it. Stop and think about that number. 1 in every 10 or 20 people in some communities had their skull open. This was not a rare, desperate, last resort act. This was a routine part of how these societies handled injury. For decades, researchers weren't even sure these people survived. Maybe the holes were made after death. Maybe they were rituals. Maybe accidents. Then bioarchaeologists found the detail that settled it. Bone remodeling. When living bone is cut, it does not stay sharp. It slowly regrows. The edges round off. They smooth over. That smoothing takes months, sometimes years, which means every rounded edge is proof of something remarkable. The patient did not just survive the operation. They walked around. They ate. They healed. They lived a normal life afterward, sometimes for many years. Their skulls are, quite literally, a signed receipt for a successful surgery. So researchers did the obvious thing. They counted. One study analyzed 800 trepanned skulls from Peru alone. Around 400 to 200 BC, roughly 40% survived. Not great, but this is Stone Age surgery, so 40% is already surprising. Then something happens that almost never gets mentioned. The number goes up. Between 1000 and 1400 AD, survival reached as high as 91%. During the Inca period, the average sat between 75 and 83%. They were getting better, generation after generation. This wasn't luck. It was a skill being refined and passed down. Now put that Inca number next to the Civil War number. Civil War cranial surgery had a mortality rate of 46 to 56%. 400 years later, with metal instruments, with formal medical training, and worse results. This is where the story stops being about skill and starts being about something else entirely. Because the Inca surgeons weren't better anatomists than 19th century doctors. They had one enormous advantage that had nothing to do with knowledge. Their operations were performed outside, in open air. Meanwhile, Western surgery moved indoors, into hospitals, which sounds like progress. It wasn't. Hospitals concentrated sick people in one enclosed space, and before germ theory, surgeons genuinely did not know why that mattered. Doctors would rinse their tools in water, wipe them down, and use them on the next patient. The same tool, the same cloth. patient after patient. So the advanced setting was actually the deadliest part of the procedure. The ancient surgeon operating on a windy hillside had, without knowing it, solved the biggest problem in surgery: infection control by accident. And then there's a detail almost nobody mentions. Some trepanned skulls were found with gold cranioplasties, meaning they didn't just cut a hole and walk away. They closed it with a fitted metal plate. That is a custom-shaped implant, which means someone had to measure the opening, shape the metal to fit it, and understand that the skull needed to be sealed again to protect what was underneath. That is reconstructive surgery, thousands of years before there was a word for it. Now here's where the whole story gets rewritten. For a long time, the accepted view was simple. Medicine got serious after farming began, around 10,000 years ago. Settled societies, new diseases, new problems to solve. The oldest known amputation supported that story. A European farmer about 7,000 years ago. Then in 2020, archaeologists walked into a cave in Borneo. The cave is called Liang Tabo. Inside, they found the burial of a young adult with a missing lower left leg. The limb hadn't been chewed off by an animal. It hadn't been smashed in an accident or a fight. It had been cleanly, deliberately removed, and the bones showed the same telltale overgrowth doctors see in modern amputation patients. The date came back at 31,000 years old. That's 24,000 years earlier than the previous record, not by a few centuries, by 24,000 years. And the patient was a child at the time, who then lived another 6 to 9 years afterward, which means hunter-gatherers, 20,000 years before farming, were performing successful limb amputations. Everything the textbook said about when medicine began was off by an entire ice age. Which brings us back to the question everyone actually wants answered. How did anyone endure this? Researchers who studied the Borneo case were blunt about it. Surviving that surgery would have been virtually impossible without something to clean the wound and relieve pain. So they looked at what grew nearby. And Borneo's rainforest turned out to be a pharmacy. One candidate stands out, a tree called Pangium adul. Its fruit is toxic, genuinely, seriously toxic. But when processed correctly, it can be used as an antiseptic. Sit with that for a second. Someone had to discover that a poisonous fruit becomes medicine, but only after specific preparation. There is no safe way to learn that. That knowledge was almost certainly paid for with lives. Every ancient remedy that worked is the surviving half of an experiment nobody recorded. But the most human detail in this entire story isn't about tools or plants. Archaeologists have found individuals who underwent trepanation 2, sometimes 3, separate times. Read that again. Someone had their skull open while fully conscious, survived it, healed from it, lived with the memory of exactly how it felt, and then chose to go through it again, which tells us something no bone measurement can. These communities had specialists with reputations, people who were known, trusted, and sought out by name. 30,000 years before hospitals, humans had already invented the doctor. So the answer to how they survived surgery without anesthesia isn't one clever trick. It's plant knowledge earned over thousands of years. It's a fresh air setting that beats sterile theory by centuries. It's specialists who got measurably better across generations. And it's patients brave enough to lie still and trust them. We didn't inherit medicine from hospitals. We inherited it from people in caves, on hillsides, with sharpened stone and a steady hand.